Service Association. Some of you I know, a lot of you I don't, which is fantastic. Just to let you know how we're going to work this the next couple of hours, and we will be out on time, so don't worry about that. Obviously, the question for today is the Challenge Fund, part of the wider Innovation Fund, which in itself is quite an innovation for government, and very different way of doing business, and I'm delighted that there's so much interest around that. What we're going to do is very standard sort of market engagement stuff for those of you who are familiar with this sort of activity. First of all, we are going to hear from the Work and Health Unit, which is the cross-departmental entity which is commissioning and funding this particular fund. They're going to go through some of the wider strategic context, some of the policy issues, etc., and give you a feel for what government really wants to achieve from the Challenge Fund. So we're going to be hearing from Laura and Julie here, who will be doing that. There'll then be the opportunity for questions specifically about that sort of strategic and policy intent. So if you then want to, really hold back if you've got detailed process questions, because after the Work and Health Unit, we're going to hear from Rocket Science, which is the entity actually running the funding process. Okay? It isn't Caroline, it's Helen Fagan who's sort of stepped into the breach today, and she's going to take you through slides which is about the application process and an introduction to the portal. Before I go any further, put your hand up if you've actually logged onto the portal so far. Had a look. Those of you who haven't. I ask this because it makes Helen really scared. Over 300 organisations already logged on and sort of had a look around. Of course, a lot of those actually will find it's not something they're interested in, but there's obviously clearly an even bigger number who are at least initially interested in this. After we hear from Helen, we're going to have a Q&A sort of session, and it's really important that you get the opportunity to ask the questions that we want. You know, we're taking for granted that after this you'll be taking a decision about whether the Challenge Fund is for you. We want you to have all the information so you can make an informed decision, and that if you do go forward to put in a bid, that is as good as humanly possible. You know, a couple other things to add. You'll see here my glamorous assistant Roger has got a camera in front of him. Do not be scared, okay, in relation to this. So what Roger is going to be doing is filming the panellists here this morning, and so this can then be uploaded onto the Rocket Science portal, along with all the slides. So the slides you will hear, you will see this morning, actually will be uploaded, so don't feel you have to take a photograph and sort of scribble down all of it. The questions and answers will not be filmed, okay? However, they will be recorded, because that helps Rocket Science produce a list of Q&As which will then be uploaded onto the portal. This is one of 4 events going on around the UK. So we had Birmingham yesterday, London today of course, and next week we have Glasgow and Cardiff. And all the questions and answers from all 4 events will be on that Q&A for everybody to have the same access to the same information. Does that sound okay? Are you all broadly all right? Come and sit down, latecomer. There will be people who are even later than you. All right? Yeah. All sitting comfortably there? Good. All right. A good hand over then to the Work and Health Unit.
Thank you, Kirsty. Morning, everyone. So, as Kirsty said, Julie and myself are from the Work and Health Unit. I lead the analytical team within the Work and Health Unit. It's, as Kirsty has said, it's brilliant to see so many of you and so many from such different fields of work who all have a shared interest in the agenda that the Work and Health Unit care about, and that's what I'm going to be sharing with you. So the Work and Health Unit, as Kirsty mentioned, is a joint unit between both the Department for Work and Pensions and now Department for Health and Social Care. We were established in the summer of 2015. I've been there since pretty much the beginning. And the key focus is on improving both the work and health outcomes for working age people, those with health conditions and disabilities. As the name suggests, we link in with our broad range of partners, particularly NHS England and Public Health England. And that focus on work and health is based, I would say this as the lead analyst for the area, but based on that firm evidence that good work is good for health and good health is good for work. And it's that kind of virtuous circle that we're trying to ensure happens through the work that we do. Specifically, the unit supports the government's manifesto commitment to see 1 million more disabled people in work by 2027. And alongside that, leading the strategy for achieving those good work and health outcomes. And that was set out in our green paper that was published in 2016, and then the command paper which followed last year, late last year. And that set out our approach for the strategy and also our vision, which set out there. So a society where everyone is ambitious for disabled people and people with a long-term health condition in respect of work. And I can't stress enough that that's about in respect of work because of the benefits that work brings for health and vice versa, as I say. The Innovation Fund was a commitment that was set out in that command paper and was designed to enable us to invest in projects that would build the evidence about what works for achieving our strategy, so for supporting people to return to work and really critically also remain in work. We know it's so important that where it's appropriate to do so, it's really critical that we keep that connection with work for people's, I'm going to say it again, work and health outcomes. To date, that's enabled us to deliver projects which have been generated through the Work and Health Unit itself, and then working with a range of partners to deliver those projects. And it's though that evidence that we're collating from those projects which will then feed into our future strategy and policy design. And now we've set aside the 5 million to launch this Work and Health Challenge Fund to ensure that we're making the most of all the ideas that exist out there, not just within the unit itself. We know there's so much activity taking place and we want to support and generate more insights into promising initiatives. Just one button. So in terms of the aims of the Challenge Fund, we have put a focus on people with mental health and musculoskeletal conditions to remain in work. And again, that's based on our evidence and data in terms of the biggest proportions and numbers in terms of conditions affecting those with sickness absence, that are disabled of working age, and those that are on the main benefits. And the purpose, as with the Innovation Fund as a whole, is to really gather that useful evidence and insight on the range of approaches tested. But we're not being overly specific about what to test, given our desire to really make the most of all the ideas that exist out there. So we're seeking applications for initiatives that focus on those conditions, although as it says there, not necessarily exclusively, and as I've said that bit, on the two most prevalent conditions. But so kept it broad in that sense, but given some ideas and shape to that, to try and make it manageable in terms of the scope that we're looking at. I'm now going to hand over to Julie to go into that bit more detail in terms of what the unit is looking for from this. Okay.
Hi everyone, my name's Julie White and I lead the strategy for both the Innovation Fund and the Challenge Fund. So have lived, slept, breathed this for many a long month. I like Laura, have been in the unit almost since the very beginning, doing different roles. And I have to say this is the most exciting one I've had thus far. Some of you will have read what the broad themes that we've set out. We have deliberately kept them broad, tried not to over-specify, to allow the innovation within that to breathe. So you'll probably hear me say a number of times what we're not about, just as much as what we are aiming to achieve. So I'll just go through these and bring them to life a little bit. If I give an example, it is only an example. Please don't think that that's what we're looking for. Because what we are very, very conscious of is there are a lot of experts, a lot of people who have lived experience out there, and that's what we're seeking to bring in, not trying to say, thou shalt do this, that or the other. So the themes themselves then, the self-management support, pretty self-explanatory, is about helping people manage their conditions and manage whatever it is that happens to them in terms of those conditions whilst they are trying to hold down a job. And it's as simple as that. The work capacity advice and support is about the support that can be given to someone when they become disabled or ill whilst in work, and may not be able to continue to do the same kind of work that they are currently doing, either within that organisation, or they may have to think about something that they can do elsewhere. The adjustments to working environments is about helping employers and individuals find workplace solutions in that employment. And what it isn't about, that's the first one, is actually reasonable adjustments. It's not about any legal obligations that an employer would have. It isn't about any of that. It is genuinely about workplace solutions. And they may be in-house, they may be brought in. It matters not. Joining up services, again, pretty self-explanatory. But that's about bringing together a range of organisations who can put a support network in place for an individual. I do speak from personal experience on this one, having to join up all the services I need because I have a serious health condition. And wouldn't it be nice if all the services could come together instead of an individual having to go out and find them? So that's that. Okay, so rather than go line by line through the guidance for applicants that's on the portal, I think it would be a good idea to talk about what's important to us, that bigger picture and our wider aims. So I'll talk a little bit about our approach in developing this and not over-designing it. What we've been very, very clear all the way along is not to have any preconceived ideas about what works or what might work. That's what we're seeking. And we want to allow for the best possible innovation in order to gather all of that evidence. Wherever we have put parameters, we've drawn them as broadly as we can and as flexibly as we can, so that within that people feel free to come up with the ideas and then put them to us. We welcome applications from every sector, which does make sometimes some of the questions a bit complex. But we know that that's the case, and we really do welcome applications from smaller organisations. And what we've tried to do with our colleagues in Rocket Science is make sure that there is a support structure in place for smaller organisations, and there are advisors, and there's a support line, and there's one-to-one advice available if people need to do that. Obviously, Rocket Science won't be drafting the applications for anybody, but whatever is needed, including if an initiative is successful, there is still ongoing support after that for them to deliver and continue to deliver. Okay. So what's of most importance, and you'll see this come through in some of the things that we'll talk about later, is that it must be new learning and evidence. What we're not looking for is anything we already know, anything that has already been demonstrated through a trial. This is your chance to say, we could tell you something new. So we are currently now putting plans in place to ask the so what question once we start to get that learning and evidence through, and to consider what might be scalable, what might be able to be replicated elsewhere, and there will be opportunities for sharing that across the networks that will develop as a result of the Challenge Fund, and we'll talk about that later. So, next slide, thank you. What we'd like to see happen as a result. So, the real driver for us is to get applications from organisations who absolutely do understand their service users, understand what the beneficiaries of a service or a product really need, and are able to articulate that in practical terms. We want to avoid duplication and to avoid contamination with other trials or existing services. That's really important, so that we don't bring any of the learning or evidence into question because of contamination. What we have done in the guidance for applicants as an annex is we as a unit have put information in there about what we are already funding and what that, a brief summary of what that looks like. But what we would like organisations to do is to do their own research and to demonstrate to us that that they have actually had a look, scanned the horizon, looked for whatever is out there, and then I've identified a gap to address. Okay, so in terms of the learning and evidence, we're very, very interested in insight and quality information, but if we can get some form of numerical data, that is also very helpful, because the more hard-edged figures that we have got, and it doesn't have to be an industry by any means, so it would really help us to then look at what's scalable and look at what the implications of making something bigger would be. So how many people could be serviced by a particular thing, what time it takes to do that, what the cost per individual is, and that kind of thing. And finally, this is really our opportunity to work with, I think, the largest range of partners and stakeholders that the unit has actually managed to work with to date. And that's the bit that really, really, I think, is going to bring the Challenge Fund to life and help the unit do what we've been tasked with doing. So, finally, the last bit from me is how you can help. Please do engage with your networks and tell them about the Challenge Fund, even if you decide that it's not for you. If it is for you, please identify the greatest level of innovation that you can, and by all means share your ideas with others and form joint ventures if that's the way that you would like to go, even with organisations who aren't registered on the portal. And most important of all, please do apply. Thank you.
Thank you very much. I think we're going to stop.
Okay, if you could be my glamorous assistant as well, just flicking through. So as Kirsty mentioned, my name is not Caroline, it's Helen Fagan. I'm the Grants Manager for Rocket Science, which is a small consultancy which grants management is one of our specialisms, but so is employment and reviewing effectiveness of programmes as well. And my colleague Caroline actually leads on the employment side, also the evaluation and learning side for our organisation. So this is why she's the project manager for this one rather than myself. Okay, so probably repeating some of what has already been covered, but just to say what we are looking for, again, that emphasis of people being in work, on people who are off sick, whether long-term or short-term from work as a result of mental health or MSK conditions, or are at risk of losing their job. And approaches we're looking for are ones that can generate valuable evidence based on the experience that you will see with the funded project, in order to meet a gap in the knowledge about what works to support employers and people in work. So it's both of those focuses. It's not just the people in work, it's also the employers. And we're not looking for academic research that includes the user control groups. In other words, we're looking for test and learn initiatives in this programme. We're also looking for initiatives that address at least one of the 4 themes which have already been mentioned. You can look to address all 4 themes or just focus your attentions on just one. Either, as long as you justify it within your application, is fine. And we're looking for initiatives as well to begin from October 2018 and finish by February 2020, and go through the timeline in a bit as well. So what funding is available? We've got a budget of 4.2 million available, and we're looking for the minimum grant size to be 50,000, and we're not looking for very, very small projects as a result of that. And we're also not, even though we are welcome to smaller organisations, we're not really looking for organisations where this is going to be their principal source of funding. We expect most initiatives to be between 50,000 and 200,000 mark, and we're also looking to pay the grant monthly in arrears, so it'll be, those are agreed on plans milestones, agreed project plan milestones. As a result, we're looking for organisations that are financially sustainable in order to afford that more. There's no requirement for match funding in your project, but the assessors will be looking for value for money as one of the elements that they're looking for. So if you can bring some element of match funding in, that will contribute to the scoring in that. So the timetable for the whole process, we're obviously in the market warming event stage at the moment, which this is the 2nd of 4. The application deadline is on the 17th of August at 5 o'clock, and just be aware that the portal shuts down at that point for your access. So you will not be able, even though you're able to access your application, you will not be able to submit your application from that point or edit it. So just be aware, don't leave it until the last minute, please. You probably won't be able to get through on the phones to us because there'll be a few people trying to get through to us at that stage. So please leave plenty of time. Applicants we expect to be notified of outcome on a week commencing the 1st of October. And we're also looking to put in place an inception workshop for all the successful initiatives to come together and be introduced to each other and start the learning process during October as well, details of which are to be confirmed a bit closer to the time. We're looking for the initiative delivery period to be between October and February 2020. We are looking for organisations to be able to run from standing start quite quickly. Yes. We're also looking to put on a learning event for initiatives about 9 months into the project to feedback from what has been learned so far to date. And we expect, because of the short-term nature of these projects, that we're hoping quite a lot of learning will be generated by that point. We're also going to be putting together a close-down and final report by March 2020. So all initiatives will need to be finished February 2020. They will be reporting as they're going along monthly, and also the learning events as part of the feedback to that close-down report. But we will need everything finished by February 2020 from the project's end. So what are we looking for in terms of assessing? So we are looking, and this information is within the prospectus of the guidance for applicants. So we're looking for the overall deliverability of the initiative. So does it stack up in terms of what it proposes to deliver? Is the costs that are outlined reasonable and justified in the application? And is the timescale achievable? We're also looking whether it's a new approach. So what evidence has been expressed in the application and used to justify the need? And how does it meet the criteria? So please do look very carefully at the criteria before starting your application. And particularly, how does it meet the criteria for people in work and across the 4 themes? Also, evidence and learning is a very heavily weighted element of the assessment. So this is a crucial part of this particular fund. It's worth 35% of the assessor's scoring, so it is very heavily weighted, and please do take the time to complete this area of the application form. We're also looking for what considerations have been given around ethics and access to data generated. So if you're the GDPR lead for your organisation, you'll be aware that there's a lot more rigorous data protection laws that you'll need to incorporate into your project and also demonstrate within your application. So does the application demonstrate a clear appreciation of the risks? Obviously, the client group that we're looking for you to be benefiting, there's a lot of issues and potential risks around that, but also there is a lot of risks with the innovation element that we're looking for. We need you in your application form to demonstrate that you fully understand these risks and any mitigations that you have put in place, or will be putting in place rather, in order to avoid these risks from happening. Okay, I'm going to briefly talk as well about the support package that Rocket Science will be providing during delivery. So each initiative will have a dedicated evidence advisor, and they'll be specialists within the field that you're working in. So we've got a range of regional and also MSK specialists and mental health specialists lined up who've worked in this field for a number of years to be able to support the funded initiatives throughout the programme. And they're also going to be providing ongoing advice during the delivery of the programme as well. Funded organisations will be required to undertake a self-assessment using Inspiring Impact's Measuring Up tool, of which there's links in the criteria itself to have a look at that. And that's in order to help us understand the needs for your organisation and plan the support package around that. We're also, as I've already mentioned, planning to organise a group inception workshop in October for all the organisations to meet their specialist advisor that's been assigned to them, but also to start the establishment of a Challenge Fund network or practice group, which is supported by regular communications from our experts and learning advisors, and also as a learning platform to help other projects in order to develop their own learning as part of that. Support from evidence advisor to quality assure research plans before initiatives start, as well as monthly reports offering help when needed. So they are available on the end of the phone. You'll be given their direct details to contact if you are encountering any issues there. And I mentioned the event that we're looking to hold in June 2019, where we're looking to disseminate the learning via existing networks from that event as well, but also to establish those partnerships between the funded organisations. Support from Evidence Advisor to produce the final initiative report as well. You will be supported in producing and what information that we'll be looking for at that time. As part of the group inception workshop as well, I forgot to mention, is that we're looking to co-design some of the elements of the programme, and so we'll be looking for organisations to feed in how they see the programme working at that point as well. We're also going to be hosting a dedicated Challenge Fund end of programme event in order to showcase the evidence gathered and its potential practical and policy uses going forward as well. So I'm just going to briefly run through as well the using the application portal. I know from the hands being shown that most of you just have already registered on the portal, but for those who haven't, I just want to talk through the steps that you'll see from it. So the link for the portal is in the top left of the slide there. So you'll be able to go into that and register for a new user account through this portal. In order to do that, it's the bottom left tab here, register, that you will need to use. This landing page just contains some information lifted from the prospectus, but it's also worth me highlighting the fact that there is the links to the guidance and the FAQs within that page as well. And also the contact us details, which is our dedicated email address for this fund and also a dedicated telephone number. So what do you do to start? You need to register for your account. And from that point, you'll see the select a scheme to start your application option then, and it's the only option on that particular page at the moment. So if you select that, you are then having the links whenever you have registered as well for the guidance and FAQs in the bottom right. Okay. So when you have selected that option, you're taken through to this screen in order to start a new application. Again, remind you of the closing date. We unlikely will be able to extend it for any reason because of the tight timeline we're on, so please get your application in with lots of time to spare. At any point, if you need to change your details, so your login details, it's going to be my account at the top there and my contact details. So if you want to add a new contact, do it through that option there. If you're going to be on holiday during the assessment period, please put another telephone number as well so we can contact you and ask any questions during our assessment. Okay. So when you have started the application, this is what the screen that you're faced with. And a few things for me to just run through what you can do through the portal is you download a PDF on the top left of this page. And also, you are given a unique application reference, which is always at the top left of the page. Please do quote that to us. We can log into the portal and then impersonate your account. If you are encountering any issues which you think may be bespoke to you, then we can see what you're seeing, so we can talk you through that or fix the problem ourselves. As well, on the top right, it shows you the progression that you have done, so it shows you percentage complete. At the moment, it's only 14% complete because there's only the one page and a little bit of the second page completed there. So it goes from blue, which is not started, to the different sections of this application form, then orange in progress, and then green complete. It also shows the required documents for the different sections. You need to have attached all the required documents, and also all of these being in green, all the mandatory questions filled out, in order to see the submit your application button. So you won't be able to submit unless everything is complete. Also on this page is further the email address and the telephone number. So if you're encountering any issues, again, that's where you contact us. Okay. When you click on one of those pages, you are brought through to the questions that it relates to. So in this example, it's the concept and rationale part of the application. Again, you've got the option to download this PDF on this page. You can also return to summary at any point. And within the notes, which is this wordy bit here, it'll be bespoke to that page the assessment weighting of that particular page, so you know when a particular element of the application is very highly scored. Pay extra attention to it. At any point you can save the progress, so if the computer crashes you won't lose any work, but also I just want to draw your attention to the fact that it does time out after 2 hours, so if you go away and then get distracted, just be aware to save before you're going to do that. Okay, so is there any questions?